We're doing a promotion right now on screening and getting screened for all types of cancer. Tell me a little bit about what you'd screen here for women's issues.
Well, women's medicine has come a long way in the past 10 to 15 years, and a couple of the issues that we want women to come in to be screened for, breast cancer, of course, so having a mammogram once a year after the age of 40 or starting at age 40, unless you have a family history or a first-degree relative who has cancer, is very important. We use a digital system now, which is less hard on the body, and sometimes women don't realize that it really is a privilege to be able to come in and get this type of care, because there was a time when we didn't have this type of care. The other thing that we screen for is cervical cancer, and a lot of times there's some confusion over what cervical cancer and how you get it. There are two kinds. There's genetic. That probably makes up 20% of cervical cancer. The other is related to HPV, which is a sexually transferred type of cancer.
You can now get vaccinated for that, right?
Exactly. And there are two types of vaccination, and it's been going on for about 5 to 10 years. But a lot of times we'll start even at the age of 12. And one is called Cervarix, the other is Gardasil. And they cover some of the major strains of HPV, which there are numerous strains. So they get a shot, their first shot, and then they get another shot a month later, and then 6 months later get that. Now, it won't protect them from all types of cervical cancer or other sexually transmitted diseases, but it will help.
And talking on other women's health issues, we're going to talk a little bit about emotional health. I know that during seasons our emotions go up and down, and women's emotions are a big thing that you probably see a lot of. Tell me a little bit about how we can help with those issues.
Yes. During the months of October and March, I see an increased incidence of depression in women and men. Some of it is related to seasonal affective disorder, because when we live in this part of the country, we don't get as much sun, so our vitamin D levels are possibly low, and we have started screening for vitamin D. But one of the issues is that vitamin D has become one of the wonder pills just recently, and there's been a lot of research done on it, but it tends to be one of the underlying issues for many things, including cancer, including production of insulin, proliferation of cells, MS even. So the closer you live to a tropical area, the higher your vitamin D. They found the less breast cancer. Now, is it a cause and effect? You know, there's much more studies that need to be done concerning that. But what we see in women is they come in, they're lethargic, they can't concentrate, they're having difficulty sleeping, they're inside quite a bit of the time. And so I started testing them, as many physicians have done, and we find that many of them have low vitamin D. So we start to boost that. And the recommended dose used to be 600 units. And now it's come up to 1,000 and sometimes 5,000, depending on what the situation is and how bad the depression is.
Well, a lot of women's issues here that you can answer. Your family medicine at Gateway Medical inside Cache Valley Specialty Hospital. Thank you so much, Dr. Goebel. I appreciate your time and all that you do here for everyone.
You're welcome.